So I won't repeat the long title of this study. Is this advanced? Here we go. Okay, these are my disclosures. Basically, this study was sponsored by BTL. So prostate cancer surgery often results in urinary incontinence in up to 60% of men who have it done. The effectiveness of pelvic floor muscle training is limited. It relies on patient commitment and physical abilities for correct responses and contractions. And current therapies really are not easy to initiate or maintain, and therefore not very effective or viable. So the aim of this study was to investigate the impact of magnetic stimulation of the pelvic floor muscles of men suffering from post-prostatectomy incontinence, or PPI, and documenting also the changes in the quality of life. And we utilized a King's Health questionnaire looking at incontinence impact, its physical and social limitations, effects on personal relationships, emotions, sleep, and pad usage, because these guys typically have to use absorbent pads because of the incontinence. This was a pilot study of 10 patients at the average age of about 73 years who underwent radical prostatectomy and were still experiencing PPI. They had 6 30-minute sessions, spaced twice a week, and then we utilized this Emsella device, and it's very easy. People just sit on it fully clothed. It's not painful, and it's basically a half-an-hour treatment. How does it actually work? Well, basically, it stimulates deep pelvic floor muscles. And the key effectiveness of this technology is based on electromagnetic energy, or high FEM, also in-depth penetration of the energy and stimulation of the entire pelvic floor. It also re-educates the pelvic floor muscles of these incontinent patients. And the high FEM actually induces supramaximal contractions of these muscles that you really can't achieve voluntarily. So you get about 20,000 contractions in a half-an-hour treatment. And then we also utilized the King's Health questionnaire, which looked at quality of life changes and also the number of pads that the subjects use. And we did follow-up visits at the beginning and after the completion of the therapy. And data was subjected to statistical analysis, and normality was tested as well. What did we actually find? Well, the King's Health questionnaire score significantly decreased, about 31 points in Part 1, 107 points in Part 2. And the patients really experienced the most significant enhancements in the following characteristics: incontinence impact, social limitations, emotions, the role limitations, and sleep, and how it affected their energy. And all these domain changes exceeded the clinically significant difference threshold of 5 points. And here you see the results in the table. So also, in terms of the questionnaire about pad usage, all 10 participants were using pads at the baseline, and the whole patient group reduced pad usage by about 40%, and actually 20% of the subjects were entirely pad-free after the treatment. And the procedure was found to be safe. There were no reported side effects, no sequelae after. So in conclusion, post-prostatectomy incontinence is a very common problem in up to 60% of patients. Current therapies hadn't been very effective or available, particularly surgery in older gentlemen. So magnetic stimulation was found to be safe and effective and offer benefits such as high comfort due to having treatment fully clothed. It's also a promising solution for individuals dealing with this issue, providing them with a renewed sense of normalcy in their lives. And we found a significant improvement in all aspects of quality of life as measured by the King's Health questionnaire immediately following the last treatment session. And also we found a reduction in pad usage by 40% of the entire patient group. Thank you very much for your attention.